Happy to be back among the land of the living. Those allergies are not a joke. I am now recovering from both a sinus infection and bronchitis, and so, like I said, I'm really glad to be vertical again. This morning I just kind of wanted to give you an idea of where I fit in the Medicare process as a consultant. I have been in the insurance business for 20 years now. Most of that time I spent actually in a State Farm office, and so I did all kinds of insurance, a little bit of all kinds. And as I developed my skills and my abilities, I finally found that I really had a desire to help people who were entering into the Medicare system and kind of help them navigate through all of those waters. I just want to point out one of the first page that I gave you headed Original Medicare. I want to just give you a small feel for what the Medicare system looks like and the components that bring together complete coverage for you. Part A is essentially hospital insurance. Part B is pretty much anything that's not hospital insurance. Medical insurance, lab work, doctor visits, things like that. It does not include prescription drug coverage, however, and that is the next step in choosing your coverage. In Tehama County this year, there are 30 prescription drug plans available for a Medicare recipient to choose from. And each of those plans require that you have, kind of do your homework, so to speak. And so that's one of the daunting tasks that a Medicare recipient has. Step 3, decide if you need to have Medicare supplements. If you choose to go with just parts A and B, then essentially you have 80% of your health insurance costs covered. And so you are responsible for 20% of the rest of it. And so these Medicare supplements can help pay all or part of that 20%, depending on how you need to, or what your budget is. One of the things that I wanted to point out to you is that when we age into the Medicare system, so to speak, for the most part we are 65 years old. There are certain exceptions to that. First and foremost, if you become disabled for whatever reason, you can qualify for Medicare prior to age 65. On the other end of the spectrum, if you are still working full-time, you may not need to sign up for the entire Medicare package. Now, generally speaking, as long as you have 40 quarters of employment, then you qualify automatically for Part A, which is the hospital coverage. It could be no premium, or you could pay depending on how much your income is for that. Part B is something that you can sign up for when you're ready for it, essentially, so long as you have qualifying coverage. We often see this for spouses who have coverage through their spouse's insurance, or perhaps they remain employed when they turn 65, and so they stay on the employer's plan. This sort of illustrates why you need someone like me. The Medicare process is not cut and dried, and so everyone doesn't automatically qualify for everything at the same time. So it's really important that we look at your specific individual needs when reviewing your Medicare coverage and looking at the options that you have available. In addition to that, some coverage, there is a window that opens up. That window can close, and you may miss out depending on what your health circumstances are, or other things that may go on in your life. Prescription drug coverage is a little bit of a different thing. Every year, the Center for Medicaid and Medicare Services provides an annual election period. It happens in mid-October through early December, and every year Medicare recipients have an opportunity to change their prescription drug plans if necessary. I recommend to every one of my clients that it be looked at every single year. That prescription drug plan is not something that should be on autopilot, and unfortunately I see that a lot. People may think, well, the premium only went up $5, or I'm not really taking any prescription drugs, so I don't need to take a look at it. And again, that prescription drug plan is just one of the most important components of your coverage with Medicare, and you absolutely need to have it reviewed every year. Not necessarily changed, but you need to take that advantage that you have to review your coverage and make sure that you have what's working best for you. The other page that I've given you essentially is a breakdown of the Medicare costs for 2019. As you can see, Part A, Part B, all of that has different premiums, if you will. There are different coverages available, co-pays, deductibles, and that sort of thing. The pages that follow illustrate what happens depending on what your income level is. Another thing about Medicare coverage is that the same coverage does not cost the same for every person. If you are on the lower end of the income spectrum, you may qualify for extra help, and so you may be able to actually pay less than the average. This year, the Part B premium for most people is about $135 a month. Again, you may pay less than that depending on what your income level is. However, if you are on the upper end of the income level, for example, if you are a married couple with more than $170,000 in earnings, you will pay more for certain coverages. Part B premiums being one of them. There are also additional fees for people who have prescription drug coverage. And so I've just sort of provided you a little bit of a guideline that gives you an idea of what kind of coverage that is available and what you may or may not pay depending on what your income level is. So I've said all of this to tell you that this is why consultants like myself are so important. Again, Medicare is not cookie cutter coverage. We all know that the internet is just awesome, but sometimes the overload of information is just that, it's an overload. And we can somehow think we're doing the best job that we can do, but without personalized help and individual planning, you could find yourself in a situation that's not the best for you. So, any questions or?
So on this, you're saying the amount that you pay is based purely on how much you make, not what your actual level of health is.
That is correct. And so, I see people enter into the Medicare system with on every end of the spectrum. Healthier than a 20-year-old, no medications, no nothing. And on the other end of the spectrum, we sort of limp, as you will, into Medicare. And that brings its own set of challenges because there are windows that do open and close. Your health can and will be something to consider down the road, depending on where you are in that area. So yes, you're correct. It's about income. It is not about your health.
That's too bad.
Yeah.
So if you take care of yourself, there's no reward for that.
Not necessarily. Well, yeah, exactly.
Yes.
Exactly. That's it. Yes. Danielle.
Yeah. So I noticed that you do the 2 years prior because the taxes aren't done by the time you're filling out all your paperwork in October.
Yes.
If your income were to drop dramatically, a lot of seniors, if they're in some sort of union, their retirement's always up for debate, kind of a thing. Is that a real time? Say their income drops dramatically, can they get their premium reduced, or do they have to wait for the following year's taxes to be done?
Essentially, when you're looking at, and it's called IRMA, is the guideline that dictates what you're going to pay. And so, yes, you're right. Let's say, for example, you had a really good year 2 years ago. And so you've got an income of $200,000, or, you may have had some sort of an inflow of cash that you don't normally have. Essentially, CMS will look back 2 years. So if 2 years ago you made $200,000, then the guidelines essentially that you're looking at, you're going to follow. Next year, you have, or actually what I should say, I guess, is that for the year following that year where you had a lot of money, say your income goes down to $50,000, then that is what the guideline is going to be in terms of how much premium. So yes, you could see them come down. You don't necessarily need to worry that because you had one good year that you're going to pay these higher premiums for the rest of your life. They use that look back period to determine on an annual basis what your premiums would be.
I can just tell you, without Robin, this is a nightmare trying to do it by yourself. I've done that. I turned it over to Robin because there's too many things going on here. And the nuances of the insurance and the Social Security, the income, it turns into a long task. It's not something simple that you can just go in and say, here, okay, because the plans change from year to year. And then the
Yes,
one
they
year
do.
changed that I had a deductible of 0, and the next year it was $500, so we had to change plans. I mean, the insurance companies don't stay constant, which is their nightmare, not mine.
Insurance companies are hitting a moving target, they're making our target.
Yeah.
That's right. There are a lot of factors involved with Medicare coverage, even more so, in my opinion, than traditional individual health for people who are under 65. If you're under 65, assuming that you have to go out and get your own insurance, you look at deductible, a copay, does it cover prescription drugs, etc. And then you're pretty much, I mean, obviously you want to look at it every year, but what you're looking for as an individual under 65 can be a lot different than what you're looking for when you are over 65. And so that is, again, and I appreciate that, Bob, because yes, it is. Trying to keep up with, now it used to be that we had a relationship with our doctor. When we'd get sick, we'd go to our doctor. Now our relationship is clouded, or if you will, there are a lot of people in the room when you go into the exam room. The government is in there, the insurance companies are in there, pharmaceutical companies are in there. There's barely room for you and your doctor in there these days. And so all of these, all of these players who are now making up a part in the components of our coverage as Medicare recipients, they've got to be considered. And if they're not, then we can find down the road that we've made some choices that were probably not the best choices that we could have made.
So are there any specific groups, 62 and above, that aren't eligible to meet with you?
Well, actually, 65 is the benchmark, if you will, for going into Medicare. But no, anyone who is getting ready to go into Medicare, I actually have clients who, by virtue of disability, are going on to Medicare prior to age 65. And so I am willing and able to help those folks navigate this whole system as well. There are programs available for extra help, just kind of different things that sometimes I just sit and brainstorm with my clients. We look at what their income level is, and then we sort of go from there. And we try to get as much help as we can, and we try to consider just, what type of injury or illness that they have that brought them to Medicare to begin with. So.
I can attest to that because about 10 years ago, the accounting industry had a huge black hole vortex being sucked out of us professionals into the insurance industry. So we knew something was coming down the pipeline when Medicare itself took anywhere between 18 to 22% of accounting graduates right off the floor as they rolled out the door.
Wow.
That's a huge amount of a profession going out. So we knew something was coming down the pike, and now we got a full alphabet of Medicare to choose from. And that's where they were going, is to do all those calculations for the government.
Probably. So for folks that may be deferring at 62 as far as Social Security to get their maximum benefit, and they are, when they hit 65, let's say they're waiting until 66, 67, so they hit 65, they get Medicare Part A, and they don't want to take their Social Security still. So the supplements, is there just kind of standard as far as for office visits and things like that that's reasonable as far as premium goes that are comparable to Part B premiums?
Essentially what happens is this. In order to qualify, or in order to get a Medicare supplement, you must be enrolled in both Parts A and B. And so if someone is 65 years old and they stay in the workforce, generally speaking, what happens is they are, if you will, automatically enrolled in Medicare Part A, which will kind of sit in the background. Medicare is always the last payer in the situation. And so, for example, let's say that you are a 66-year-old full-time employed individual. You may have your Medicare Part A is active, but you've also got your group health coverage. So if you go to the doctor or whatever your need is, you continue to use your employer group coverage, if you will. Once you decide to retire, then you drop that employer health coverage in many cases, then you become eligible, and that opens up an event, if you will, so that you can go ahead and apply for your Part B. Now you've got Part A and Part B, and that opens up that window for eligibility for you to make your choices on the Medicare supplement that you want to usually stay with moving forward. And that's what makes it different from the prescription drug coverage. When we look at the Medicare supplements, we're looking essentially to keeping the best coverage that you can, the best affordable coverage that you can have, that you will keep moving forward. Whereas the prescription drug coverage, we look at that every year because it can and does change. And one more quick thing that I wanted to mention in terms of statistics. Colleen, you reminded me of statistics. 10,000 people a day are aging into the Medicare system. And I'm not sure how many people are coming off of the Medicare system, if you will, every day, but I can assure you it's not 10,000. And so we are seeing the Medicare system just getting bigger and bigger and bigger. And so, like Colleen was saying, you know, they've done what they can to prepare for this, because us baby boomers are really crowding the system, if you will. And so that's another reason to have someone like me, because what used to be a fairly static program, it's changing literally weekly, depending on which component we're talking about. Big time changes going on all the time now. So.
Are there any options for dental coverage?
There are not, and that is the other thing that has to be considered as well. If you're going to have an overall wellness program for yourself, if you will, a couple of things to remember. Dental coverage is important, vision. The other thing that's really important to understand is that Medicare nor supplements pay for benefits for long-term care insurance. So that means that if there is the eventuality that you need to be in a nursing home, if you will receive no help from Medicare for that. And so that's another thing that, you know, fortunately in our group, in NSPN, we have a group of professionals that assist people who are moving into the retirement system. And so we have CPAs and we've got financial advisors who can help us to, you know, look at a very probable event moving on down the road in our extreme age. So, yes, dental coverage, vision coverage. And our teeth, I always tell my clients, you know, you only have to pay for the teeth that you want to keep. And, you know, it's pretty simple.
So, the majority of us in this room, and I'm not saying it's a negative, Bob, but we're not quite ready for your services.
Right.
All of us being business owners, whatever it might be, we tend to be planners. And with Brady and with Colleen, we talk about planning for taxes and planning for retirement. Well, I think this is a little part of planning for retirement.
Yes.
What can we maybe do now to better position ourselves to make this better in 10, 20, 30 years, whatever it might be?
You know, that's a difficult answer. I think in some ways, as I said, we are looking at a system that's getting bigger and bigger every day, and in my opinion, makes it less and less navigable. And so what I recommend in terms of when are you going to start planning for your Medicare, I talk to people essentially just about 6 months or so before they turn 65, so that they have an idea of what is going to be, you might say, an automatic thing, and by that I mean your Medicare Part A. And then what are your plans? Are you going to keep working? Are you going to go ahead and retire? So that is, the Medicare planning, if you will, is actually, you know, relatively speaking, sort of a last minute thing. You'll want to talk to Brady and to Colleen long before you will talk to me when you're getting into retirement. So.
Yeah, I just wanted to give a shout out. Thank you for not recognizing me under 65.
I didn't want to assume.
But I had, before I met Robin, I had gotten my Medicare thing together at a different place, and I never felt fully informed, like they were taking care of it, but I was still ignorant. And I've met with Robin twice now, and although I still consider myself very ignorant about it, I feel more aware of what and why, so I appreciate that.
Thank you. Appreciate that too.
So most of us in this room are self-employed. Well, I guess not most of us, but I buy our insurance through Covered California. So, obviously not having it from an employer, that means I would probably just go straight into Medicare. Or I really like the insurance policy that we have now, and my husband's a few years behind me. So would it make more sense for me to stay, you thinking, under the policy I have now, and then do Medicare later rather than split us up and get his through Covered California and mine through?
What I would say is that when you get ready, like I said, when you're about 64 and a half, is when we sit down and we start looking at some numbers.
Okay.
And as you mentioned, you may have a very affordable plan through Covered California. However, what I do is I sit down and we start putting some actual numbers together. And obviously this is not the case for everyone, but for a great number of people, once they have entered into the Medicare system, they see their recurring health care costs go way down. And so while it may be a possibility for you to continue a certain coverage that you like or things like that, a couple of things happen. You may still in name have that plan, but when the insurance carriers realize that you're over 65, they kind of do some things and they may put you into a different type of coverage and all kinds of different things. But again, as I said, depending on what the circumstance is, I would say that most of my clients are very happy with what happens with their health insurance premiums when they age into the Medicare system, if you will.
Cool. Good to know.
So that's another reason why. And that's the other thing too. I do not charge for my consulting services. If I sell you a policy, I earn a commission. But this is very important to me, and I think it's important that we are educated and that we have a good idea of what we're looking at as we make this huge transition from one system, if you will, or one type of policy into another one. And so I take the time to explain. And, again, I don't charge for my consultation services. I happily accept referrals, however, so there's always that. So,
Great, thank you.
anybody else?
I feel like you should just put your office. Here's Brady, here's Colleen, here's you.
Trust me, I've thought about that. It's sort of like running people through a car wash, if you will. Go to the Robin station, the Brady station, the Colleen station.
You're done.
Absolutely. Okay. I know I took a lot of time. Thank you guys so much.
Thank you.